So we have a lot of patients here that suffer with what's known as aortic valve stenosis, and a lot of our patients in our community here are unable to tolerate an open surgery, either because they're high risk or they're frail or elderly. So we have something what's called TAVR, which is Transcatheter Aortic Valve Replacement, which is a minimally invasive surgery where we actually can go through your femoral artery and deliver the valve via a wire. What it actually does is it pushes your old valve out of the way and immediately starts operating as your normal valve would. We do that here at AdventHealth Port Charlotte. Some of the advantages are it's minimally invasive, so usually you spend the night in the hospital and you're home the next day. A lot of patients really like that. We get you up immediately the next day. We have you ambulating in the halls, and your recovery process is very minimal compared to an open surgery.